All right, team 6.
Alrighty. Okay, well, hi everyone. We appreciate everyone being here today. So we are down team 6, and together with Molly Berg from Habitat for Humanity and Dr. Andrew Ibrahim here at the University of Michigan, our faculty advisor, we're excited to present our project, Energy Efficient Housing, as a healthcare intervention in communities facing environmental injustices in Climate Zone 4. So before getting into our project, I just wanted to introduce the team. So my name is Emily Human, and these are my lovely teammates, Brooke Troxmondo, Natalie DeLiso, and Jacqueline Louie. So getting into the background of this project, exploring sustainability in the residential sector has the potential to make a massive environmental impact. Buildings are responsible for 39% of global energy-related carbon emissions, and residential electricity emitted 9.1% of the US's total emissions for 2021, highlighting the need to improve energy efficiency in the residential building sector. And as one of the largest residential builders in the United States, Habitat for Humanity International has the potential to make a massive environmental impact in this way. However, there's often a lot of barriers to equitable, sustainable construction due to some of the higher costs associated with sustainable building and social and environmental inequities that affect low-income and minority communities. So considering the impact that the residential building sector is having on the climate crisis and the barriers low-income communities and affordable housing developers face in implementing sustainable construction, our team set out to answer the following question. How can we create actionable design strategies that connect geospatial data on environmental injustice and social determinants of health for increased equity, sustainability, and affordability in the housing sector? So to address this problem statement, we developed indicators that directly connect health and housing and the built environment. We focused on social, environmental, health, and housing indicators, and we used these indicators to develop a ArcGIS web map that we'll get into in greater detail later in the presentation. But for now, I'm going to pass it on to Brooke, who's going to go into these indicators in a bit more detail.
Thanks, Emily. So people are at the center of both public health and the built environment. So we wanted to select some indicators that could tie people to both of these subject areas. We chose the concentration of senior citizens because this is the part of the EPA's definition of vulnerable populations. Energy burden illustrates the percentage of a household's monthly income that's spent on energy costs. And social capital measures the connectedness between community members. Environmental factors also play a big role in the health of people and also the effectiveness of the built environment. So the two indicators we chose here are the rate of temperature change over the past century, kind of as a proxy for what temperature change might look like moving forward, and also exposure to air pollution, as this is tied to health. Next, we wanted to look at some specific and prevalent health ailments that can potentially be positively impacted by changes in the built environment. So asthma, high blood pressure, cancer, diabetes, and poor mental health all fit those criteria, and they're also part of the CDC's Environmental Justice Index. Finally, we wanted to focus on the built environment itself and how it can impact both health and the environment, as Emily mentioned earlier. So for these indicators, we chose the concentration of houses built before 1980, as these structures have a higher likelihood of containing toxic chemicals like lead paint, and also the concentration of houses with non-electric heat sources, as these present opportunities for electrification. The next, after we gathered all these indicators, we wanted to represent them spatially, so we developed a publicly accessible web map. We wanted to make sure that there was reliable data for all of the indicators, and then we worked to combine them with the spatial data from the US Census database. Habitat and its affiliates will be able to use this map to identify trends with all of the indicators we developed, and I'm going to hand it over to Natalie.
Okay. Building off the geospatial indicator data, the Design Strategies booklet was developed to bridge the gap between health outcomes and the built environment. We began by collecting information from trusted sources, determined our target audience, chose our focused housing typology, and performed field research on an existing Habitat home. We compiled this information into 3 different categories: GIS outputs provided to Habitat, and an integrative a publicly accessible webpage map, a healthy housing strategies design booklet that provides design recommendations, and a final report and presentation. Here's a snapshot of our current interactive web map. Feel free to scan the QR code to check it out for yourself. Once in the portal, users can toggle through previous mentioned indicators using the layer list tab shown on the right. These green dots shown here represent habitat affiliates, so they can understand how their geographic region performs in relation to the selected indicator. In this example, which is measuring exposures of air pollution, the darker color correlates to higher rates of exposure. This may help users understand potential health vulnerabilities and respond accordingly to the design strategies provided. The research supporting this booklet sources include such as CDC, EPA, International Well Building Institute, the World Green Building Council, and existing Habitat for Humanity resources, among many others. Given the scale and influence of Habitat for Humanity, we hope our design strategies booklet can set a precedent for home builders within the US. While these design guidelines are first intended for habitat, we wanted to ensure a wide range of user types could also benefit from this information. Our goal is to empower and educate and provide designers, builders, and homeowners with key insights that highlight the profound impact the built environment has on health and the tools to improve their quality of life. We've divided the booklet into key sections to include a how-to guide, a case study, and our selected indicators to make it easy to navigate. Each indicator has been geospatially coded to make it within our webpage and categorized into either housing, social, environmental, or health. With each of our selected indicators, we wanted to ensure the possibility of responding with a reasonable design strategy that could translate both new construction and renovation work.
So lastly, just to take us through what the design strategies booklet might look like for our Habitat affiliate, as well as anyone else who might be interested in using it. Here's an example of how the booklet explains how to use the web map, for instance, and it goes through step-by-step different ways to look at climate zone 4 and the different indicators we included as part of our analysis. Here's another visual example of what the web map can do. This one is looking at asthma prevalence, for instance. And again, the darker colors correlate with higher asthma prevalence, and the lighter colors with less asthma prevalence. The green dots are the habitat affiliates. And again, this could be useful in seeing if you're a member of a habitat affiliate, what types of conditions and what types of environmental exposures might be more common in your area, and then you could tailor housing solutions to better serve the community around you. And this is an example of how our booklet complements that web map. So we can visualize what the asthma prevalence is around the different habitat affiliates, but in terms of making recommendations around that, we investigated different solutions such as adequate filtration, different indoor heating sources, different vegetation like low pollen plants, and different ventilation solutions, which could hopefully reduce asthma exacerbations, which can be deadly in some instances. So lastly, taking a step back and thinking about the overall impact that we're hoping our project could have. So we're hoping that this project can address the intersection between the environment and human health, especially as that relates to housing in our country. We hope that this will provide more in-depth information about the challenges surrounding specific habitat affiliates in Climate Zone 4. And we also hope in the future that this could have an impact for further study, for example, beyond Climate Zone 4, which we studied at the request of our Habitat for Humanity. And overall, thinking about how this complements global strategies for addressing sustainability. We think that it addresses the UN sustainability goals of good health and well-being, industry, innovation, and infrastructure, sustainable cities and communities, as well as climate action. And on the right, we have a picture from our site visit to Catawba in North Carolina, which was just to provide a more in-depth case study of how this could affect a specific habitat affiliate. And lastly, we'd like to say enormous thanks to the many people who helped us complete this project. Molly Berg, who was our our main point of contact at Habitat for Humanity, Dr. Andrew Ibrahim, whose enthusiasm was and amazing knowledge of everything to do with health and housing was essential for our project. The wonderful Graham Sustainability team for facilitating everything this year, and the Dow Company Foundation for allowing us the resources and time to complete this project. So thank you all. I'd like to open it up for questions.
Excellent, very good. Okay, questions. Okay, you may lead us off.
This is a fantastic presentation, and I really appreciated the beautiful maps. My question is actually for my dad, because he is a contractor nearby, and I've talked to him countless times about moving more into sustainable design practices, but as I'm sure you're aware, there's a huge barrier to entry for people that didn't study that in school, because he's entirely self-taught and works long hours, so he doesn't have time to find the new info. What's your plan for circulating the design strategies booklet, and can I have a copy?
Thanks for the question. I think that kind of gets at one of the points we tried to make, is making sure the audience is for everyone. The goal is to start first with Habitat and have them use this as a resource and distribute it out through their organization. We also wanted to kind of link it through the publicly accessible web map. I think as far as creating more strategies to get it to the wider audience, I think that that'll largely happen through the streams that Habitat is setting up. I know they partner a lot with volunteers or other builders, so I think starting with them as a point to distribute will be a really good strategy, but I think we should probably be thinking a little bit broader too of other ways to get it out beyond Habitat's reach. So I think that'd be a great suggestion for future.
And all the information we used is publicly accessible. Habitat didn't give us any priority data, so we do have permission from them to share it with the public, which is why the web map is accessible. So we'll send it to you. And your dad.
I can just talk loud. I don't need the microphone. Can you tell us a little bit more about the site visit you did, what you learned from that, how it applies to the work you're doing?
Yeah, so I had the opportunity to visit the Catawba Valley affiliate in North Carolina, and they are pioneering sustainable building strategies, and they're doing it a lot through partnerships, which might be another option for your dad, Izzy. That's where they get a lot of the funding. So there's several nonprofits in North Carolina that have kind of sustainability standards, and there's even a partnership with I'm blanking on the name of the energy company. I think it's Duke in North Carolina, where if they follow certain building strategies, that Duke and the nonprofit will guarantee an energy bill of $40 or less per month if those standards are followed. So kind of replicating those partnerships, encouraging other nonprofits to help elevate these building strategies was one of the main things we took away from that visit.
I can also be louder. Was there any looking into deconstruction options as far as we are putting new buildings on land, and that is inherently a more extractive and intensive use of resources? So was there looking at how you can retrofit, how you can adapt, but then also end of life, what happens to these structures so that they can be more circularly economized?
That's a great question. The most sustainable thing is not to build new. So Habitat, they largely do focus on single-family homes. They are stepping to multifamily, but their reach is not just new construction. It also is retrofit and rebuild and renovation work. And so that's something we wanted to tap into more specifically. For this booklet, given the scope and scale, we wanted to make it more about kind of single family or duplex, not go so multi-story with the sort of recommendations. But we wanted to tap into the existing infrastructure they have around their renovation work. One of the things we did notice too with dealing with Habitat is that the organizations are very sometimes siloed a little bit, so the new construction don't necessarily talk to the retrofit. And so we wanted to have some sort of resource that can bridge that. And so this booklet and all the responses that it has to the certain indicators is built also for renovation work or small scale changes that existing homeowners can actually use. We didn't dive into end of life cycle. specifically. So I think that's also something that we could kind of have the next cohort look into possibly.
Just like, I just would like to add briefly, I think too that one of the benefits of our booklet as well as the web map is that there are certain things that we don't necessarily have the power to change and Habitat may not have the power to change, such as exposure to air pollution in a certain neighborhood or a certain city. We hope that having these types of maps and these types of resources, we hope that when it comes to Habitat making decisions about new building versus retrofitting versus using, choosing a site, that these could be helpful in helping them make a thoughtful decision about what would be best for their community. But we did think about there are, new construction versus retrofitting, but we hope that this will provide them the tools to make that best decision for their community.
Another question? And use the microphone, please.
Yeah, thank you for the presentation. In terms of affordability, I was wondering if you guys looked into addressing how, energy retrofits and inefficiency and weatherization can often lead to gentrification. So I was wondering, in terms of housing affordability, if you guys looked into addressing that.
Yeah, so Habitat works directly with homeowners and they can help subsidize the cost of the housing based on the homeowner's income. And so the homeowners have to have a certain range of income in order to qualify for a Habitat for Humanity house. So we didn't look into that specifically, but Habitat does address that issue with kind of how they structure their homeowner programs.
And then I also think it's worth noting that when we met and presented our findings to Habitat for Humanity, the cost of different sustainable practices in building was asked of us. And I think it's super important because even though we all have wonderful ideas and there's so much technology out there, sometimes it's not financially accessible. And I think that an area of future research that could be super helpful is potentially identifying grants or different financial resources that could be used to help make homes more sustainable and healthy, as well as doing some type of analysis where you could say, well, if we, implemented solar panels or something with this house, how long would it take to recoup the extra costs of using that upfront, and how long would it take for that to equal the cost of using a different energy method that might cost more in the end, even though it might be cheaper upfront. So I think that's super important and not something we delved into, but something that could be addressed with a future Dow cohort, for instance.
All right. Well, thank you guys so very much.